Dr. Ashok Agarwal, Managing Trustee of NLR India Foundation. Leprosy is a very old disease. It has been there for more than 4,000 years in this world, and it is still occurring. Globally, still we get around 200,000 new cases, out of which 60% happen in India, which means India has a huge responsibility towards elimination of leprosy. Earlier to 2016, we did not have any medicine for preventing the spread of leprosy. What we had was detect the case early and treat the case early so that new persons getting the infection, there is lesser chance. But in 2016, NLR, for the first time in the country, we tested the single dose rifampicin in Dadra Nagar Haveli, and government was so encouraged to see the results in 2 years that by 2018, on the birthday of Mahatma Gandhi, on 2nd October 2018, it adopted it as the national program. And this has brought in huge benefits across the country in terms of reducing the number of new infections. But nonetheless, in addition to this preventive therapy, the detection of new cases is paramount, because unless that is done, the disability is going to happen. Now, I can also mention the effect of COVID. The COVID, as we know, has brought in havoc in the lives of everyone across the globe, and has also brought havoc in terms of management of public health program. Also, leprosy has been affected. Now, what has happened is in the last 2 years, the detection of new cases has gone down by almost 40%. Now, it does not mean that the occurrence of cases has gone down, but these cases are hidden. Now, these cases being hidden, what happens is the detection, the treatment, the prevention, everything gets delayed, which means that there is greater spread of leprosy in the community, and also there would be greater chance of them having disabilities, and many of these disabilities may be lifelong, and which actually causes the maximum suffering in leprosy, and that is why leprosy is a dreaded disease. The challenges which still persist, and in a good way, are: number one is stigma and discrimination. Now, because of stigma and discrimination, what happens is that people find it difficult to come out and seek services. I can relate to you one story which I encountered only last week, which was a person affected by leprosy. He took 3 years for revealing his status to others. Now, we asked him why it was so. He said, well, I thought that once I reveal it, people will stigmatize me. I would have no place in the community. Then we checked with him that how was the behavior of your family. He said that family was behaving well, but still with the family we decided, well, we'll keep it a secret, because none of us was feeling comfortable to reveal the identity to anyone else, and which this means that still we have good amount of stigma and discrimination. The second challenge which I feel is very important is the supply of the rifampicin for preventive therapy. Now, though MDT is freely available across the country, but single dose rifampicin is something which has been introduced, but still the procurement process at the district level, at the state level, has to be established. NLR India Foundation recently celebrated its 23rd year on 23rd of April 2022. Now, these 23 years have been possible because of the support which it received from NLR International. NLR International is based out of Netherlands, and it works in 5 countries of the world: India, Indonesia, Nepal, Mozambique, and Brazil. And India happens to have the maximum number of infections, which is 60% of the global load. Now, this organization thought very early on that let us go and start our work from a place which has the maximum need. So Bihar was selected. And in fact, only recently, the NLR International team was here and we jointly observed the Foundation Day in Bihar on that day. And we interacted with the stakeholders, the government, WHO, other partners of NLR, the community stakeholders, and it was a very good experience wherein we realized that we have made great strides in our journey of leprosy, wherein we have not only found out the something to prevent leprosy, which is a preventive therapy, single dose rifampicin, but also NLR's big contribution over the years has been developing different models of self-care. Now, people with disability, they require to do self-care almost every day. For example, if they have ulcers, they need to be cared for. If there is weakness in the limb, some kind of exercise needs to be done. If there is a problem with the eyelids, again, some kind of exercise needs to be done. So similarly, the person is not in good mental well-being framework. So the person needs to be engaged with the community. So several models of self-care we have evolved over the years. First model, it works in the community. Second model, it works at PSC level. Third model, it combines leprosy care with lymphatic filariasis care, in which also the limbs are affected. And the fourth model, which we have evolved in West Bengal, is reaching out to thousands of such persons affected in their homes through ASHA. Now, this model seems to be the most promising model, where it is through an existing structure, a structure which reaches out to the last person in the community, and through a process where we train the ASHAs and the ASHAs do the rest of the work. NLR is working with the vision of zero leprosy, and we follow the three strategic pillars which have been defined globally, which is zero transmission, zero disability, and zero exclusion. And we have programs on each of these zeros. All our activities are with government. We have a very strong association with government at the Central Leprosy Division and the 7 states we work in. We don't do any activity in parallel. We try to fill in the gaps of the government, and we also try to bring in innovations. For example, the single dose rifampicin, which I spoke about, we are trying to bring in innovation which can make it more efficient, like we are developing a mobile app through which the implementation of SDR-PEP will become easier.